You're watching Rogers TV, Barrie.
Okay. Dr. Charles Garrett, Officer of Health with the Simcoe Muskoka
Recording
District
in
Health Unit,
progress.
here to provide you with the update for COVID-19 for Simcoe Muskoka. So it's been 2 weeks since I last reported. That was on October the 20th. And now we've had a total of 14,112 cases. This is up by 278 cases over the last 2 weeks, or 72 cases for the week to date, starting from October the 31st. So we've had a 4% increase in our cases locally week on week. So 127 cases during the week of the 24th to the 30th of October, compared with 122 cases the week before. And during that period of time, the province decreased by 5%. So while they've been decreasing, we've been increasing. We've actually had increases over the past 3 weeks in total. So if you go back to the week of the 3rd of October, we had 135 cases, and then it went down the week of the 10th of October to 111 cases, and then it went up to 122 cases the week of the 17th of October, and then up to 127 cases the week of October the 24th. So a 3-week period in which we've been edging up over time. We have a total of 193 active cases, and this is up from 145 active cases 2 weeks ago. And we've had a total of 267 deaths. So since I last reported 2 weeks ago, we've had 5 additional deaths. And I would like to express my condolences for the family members for your loss. And these people are as follows: a man between the ages of 65 and 79 from Simcoe County, a man 80 or more years of age from Simcoe County, a woman between the ages of 45 and 64 from Simcoe County, a man 80 or more years of age from Simcoe County, and a man 65 to 79 years of age from Simcoe County. And we actually only have one of those who was not immunized. So the rest of these are breakthrough cases, people who are fully immunized. We have 21 individuals in Simcoe Muskoka, from Simcoe Muskoka, who are hospitalized now, up from 8 2 weeks ago. 2 of these are in the intensive care unit, which is down from 4 2 weeks ago. Their ages range from 10 or above to 90 and above. And 20 of them are from Simcoe County, and 1 is from Muskoka. 70 acquired their infection in the community, so we don't know exactly how or where they acquired their infection. 3 are close contacts of a case. 8 are part of institutional outbreaks. And 1 was travel related, and 1 is under investigation. We note that 11 of these individuals were not immunized, 8 were fully immunized, and 1 was partially immunized. Over the last 24 hours, we've had 33 new cases. So 26 are sporadic cases, 3 are from school-related outbreaks. 1 is from an institutional outbreak. 2 are from community setting outbreaks, and 1 from a workplace-related outbreak out of jurisdiction. 17 are male and 16 are female. Their ages range from under 10 to in their 60s. And 9 of the 33 are children under the age of 18. All are from Simcoe County. 7, with regards to how they were acquired, 7 are under investigation, 6 are close contacts of the case, 11 are community acquired, 1 is part of an institutional outbreak, 3 are part of educational setting outbreaks, 2 are travel related, and 1 is part of a workplace outbreak, and 2 are part of outbreaks in community settings. 32 of these are self-isolating at home, and 1 is hospitalized. With regards to immunization status, 10 of them are unimmunized, 3 partially immunized, and 11 fully immunized, and 9 of them not eligible to be immunized due to their age, being under the age of 12. The greatest number of cases are in South Simcoe and Barrie, which has been the case throughout the pandemic. Innisfil has the highest incidence at 44 cases per 100,000 population per week. Barrie, Bradford, West Gwillimbury, Orillia, and Springwater all have weekly incidences above 30 cases per 100,000 population per week. Specifically for Barrie, there was a question from the media about cases in Barrie and whether or not they're high and what this would mean. So Barrie's incidence over the past 3 weeks has ranged as follows: 25 cases per 100,000 population for the week of October the 10th, up to 33 cases per 100,000 population for the week of October the 24th. So there's been some variability, but not a high degree of variability for Barrie, and they are among the higher incidence municipalities in Simcoe Muskoka, but not the highest, in keeping with their status throughout the pandemic. And in terms of the absolute number of their cases, they are going to be high relative to other municipalities, in part because of the size of their population, being our largest single tier, lower tier municipality. So the incidence of cases in Simcoe Muskoka in the past week has been 21 per 100,000 population per week, 4% higher than it had been a week ago at 20 cases per 100,000 population per week, and below, I should say, above the provincial average at 17 cases per 100,000 population per week, which is a reduction from 18 cases per 100,000 population the week before. So the province is lower than we are now and has been going down slowly, whereas we've gone up slowly over the past 3 weeks. And this is the second week in a row that we've been above the provincial rate, and the first time in the pandemic that we've been above the provincial rate. So we're not above it greatly, but we are above it. And as I said before, the first time for us. The percent of our cases over the past week that occurred among children less than 12 years of age has gone down slightly. So 25% of our cases were among children under 12 years of age during that week, compared to 29% the week before. And the percent of our cases that are community-acquired cases, where we don't know where transmission occurred or how it occurred, is 29% over the last week, compared to the 18% over the week before. And typically, throughout the pandemic, it's been in the range of 20 or 25%. 100% of our cases over the past week were due to the Delta variant. And we have 8 active outbreaks at the moment, up from 4 active outbreaks when I last reported, all of them due to the Delta variant. So we have 3 ongoing outbreaks: educational setting, Holy Cross, public school in Innisfil, declared October the 15th, a total of 27 cases, up from 15 cases 2 weeks ago. A long-term care facility, Mill Creek Care Center in Barrie, declared October the 15th with a total of 3 cases, up from 2 cases. A correctional facility declared on October the 18th with a total of 16 local cases, up from 5. And we have additional newly declared cases Actually, I do need to correct myself on a point. We currently have 11 active outbreaks, up from 5. So I gave you an erroneous figure. 11 active outbreaks, up from 5. So we have a total of 8 newly reported outbreaks over the past week, up from 3. And they're as follows. An educational setting, Asakanaka Public School in Barrie, declared on October the 22nd with a total of 15 cases. An educational setting, Portage View Elementary School in Barrie, declared on October the 22nd with a total of 2 cases. We have another educational setting, Monk Public School in Bracebridge, declared on October the 25th with a total of 2 cases. We have an outbreak in a hospital, RVH, at their transition care unit, declared on October the 29th, a total of 12 cases. And a long-term care facility, The Pines in Bracebridge, declared on October the 30th with 2 cases. And a congregate setting, a shelter in Simcoe County, declared on November the 1st with 2 cases. An educational setting, St. Catharines of Siena and Barrie, declared on November the 2nd with a total of 7 cases. And a community setting, a recreational facility in Simcoe County, declared November the 2nd with a total of 2 cases. And we have 2 outbreaks that have been declared over the last 2 weeks. So one in educational setting, St. Marie of the Incarnation in Bradford, West Gwillimbury, declared on October the 1st and declared over on October the 21st with a total of 21 cases. And another educational setting, Orchard Park Public School in Aurelia, declared October the 5th and declared over on October the 21st with a total of 10 cases. In terms of immunization, we continue to make progress on the last mile. And the province, of course, has its target of 90% coverage for 12 and up for both first and second doses. So in Simcoe Muskoka at this time, 87% of those 12 and up have received their first dose, which is up from 86 when I reported 2 weeks ago. And 83% have received their second dose, which is up from 82 2 weeks ago. We continue to have the lowest coverage among young adults, and in particular young men between the ages of 18 and 29. And we are making progress with regards to the provision of third doses for all eligible residents of 30 long-term care homes in Simcoe County, with more than 2,500 residents having received their third dose. And there are currently 7,595 Simcoe Muskoka residents who've received a third dose of vaccine. The protection that's provided by this vaccine is very, very important to note. So we note that those who are not immunized are 8 times more likely to develop symptoms of COVID-19 and 13 times more likely to be hospitalized compared with people in Simcoe Muskoka who are fully immunized. So this is Simcoe Muskoka data for the period of September the 5th to October the 30th. We also note that over the week of October the 24th, 35% of our cases were fully immunized. So those are breakthrough cases. So we have had the incidence of breakthrough cases in that range in recent weeks. And I have noted that we expect that rate to go up over time as we continue to progress towards immunizing an ever greater proportion of our population, having an ever smaller proportion of our population unimmunized or incompletely immunized. So by function of mathematics, you will end up seeing the percent of our cases be breakthrough cases as time progresses and we move towards immunizing virtually all of the eligible population. When we look at our dashboard, we remain in yellow status with red status for viral spread and containment. This is due to a continuation of our new cases. Our active outbreaks actually going up and increase in new hospitalizations among cases. We note that the laboratory testing status is green with regards to the turnaround time for test results to come back, and our percent positivity being at 1.8%. So below 3% is desired, certainly above 3% is of concern. We are at 1.8%, up from 1.5% when I last reported. And in terms of public health capacity, we are in yellow status, so some improvement. We are reaching 80% of our cases within 1 day for follow-up, which is up from 76%. And contacts, 71% reached within a day, compared with 70% in the last time I reported. Okay. So a few reflections with regards to the rollout of third doses. Dr. Kieran Moore, Chief Medical Officer of Health for the province of Ontario, addressed the province today at 1 o'clock with regards to the province's direction to health units and the rest of the healthcare system about third doses. His direction is in line with the National Advisory Committee's for immunizations recommendations that came out last Friday. We are supported to provide immunization third doses for adults above 70 and above years of age. For people who've received vector vaccines for their first and second doses, so AstraZeneca vaccine for first and second dose, or if they'd received the Janssen vaccine. For adults from First Nations, Inuit, and Métis communities, and for adults who are frontline healthcare workers who have direct contact with patients. The National Advisory Committee on Immunizations recommendations are really specifically for healthcare providers who've had a very short interval between their first and second dose. The province is actually enabling us to provide immunization for healthcare workers, regardless of the interval, to receive a third dose, provided that they work in an environment with direct contact with patients or others in the healthcare system that are working within an environment with patients. And for these individuals, a third dose would be supported 6 months after having received their second dose. One thing that the Chief Medical Officer of Health notes is that people persist with good protection with the first and second dose of immunization. There is some waning of immunity that occurs over time, in particular beyond 6 months, and in particular for some groups more than others. So older individuals, those that are residents of long-term care facilities, would be at a higher risk of waning immunity, declining immunity, and in particular would benefit from receiving a third dose 6 months after having received their second dose. But we do have support to provide immunization third doses 6 months after receiving second dose for those other groups that I've just cited. The province will be enabling bookings to take place on their booking system starting on Saturday. And at that point, community pharmacies and participating primary care clinics offices would be able to provide third doses to individuals. Actually, commencing today, even ahead of the booking system coming online for the province, pharmacies and primary care that are participating would be able to provide those immunizations. Our health unit clinics, which will begin on the 15th of November, would be available to receive bookings when the provincial system comes online on Saturday. The clinic being run by RVH at 29 Sperling would be able to receive bookings to commence with immunization on Sunday. So people have a number of options. And for those that are healthcare workers, we know that our hospitals are committed to providing their workers with immunization. And a number of family health teams are also committed to providing immunization to their workers. So those that are eligible would have those options at their disposal. Healthcare workers in those settings being able to get it at their workplace. Older people in the community, 70 plus, should be able to get it at pharmacies. The Indigenous population, we are working with our First Nations communities in order to have community pop-up clinics for them to provide immunization starting next week. And as I've indicated, beginning on the 15th, our health unit will also have community clinics, and beginning Saturday, people will be able to book into those clinics. Our intention with those clinics on the 15th is to also be prepared for an announcement from Health Canada and from the province about the immunization of children 5 to 11 years of age. We don't know yet when Health Canada will make its final approval and when the National Advisory Committee on Immunization will be coming forward with its recommendations about the immunization of children 5 to 11 years of age. But we do want to be prepared for that. So those clinics are available, ready for that purpose, as well as for other individuals who are eligible to receive booster shots. We will have that information up, but the details about that at a later point. We don't have that information about those clinics yet up on our website. Another thing I would emphasize is that those who've not received yet their first and second dose who are eligible really should proceed with that as well, and to take advantage of all of those venues and opportunities to receive their immunization. We want to very much continue with our progress on the last mile to get above 90% coverage in the eligible population for first and second doses. I am announcing that we are putting a pause on the provision of other vaccines in our health unit offices at this time. I had announced previously our intention to provide immunization for grade 7 and grade 8 students to do a catch-up on the grade 7 immunizations. However, we've had to put that on hold because of the limited capacity we have and the need to focus on COVID immunization, booster, third doses, and be ready for the vaccination of 5 to 11-year-olds. And so for that reason, we put grade 7, grade 8 immunizations on hold and are now also putting on hold catch-up vaccinations for other vaccines in our offices. Those who wish to obtain those vaccinations at this time can inquire with their primary care provider. We are continuing to provide vaccine to primary care providers to enable them to provide vaccine. And certainly this is a priority for us in the future to be able to do catch up for them, but we don't have the capacity right now to be able to do that. You may note on our website some change with regards to the vaccine coverage by municipality. We've had detailed information on our website for quite a while now about the percent of coverage by age group, by municipality. And more recently, very recently, as of October the 29th, we've updated that information using a more accurate, better method to determine that rate of coverage, being able to more accurately allocate where people live, basically, as part of the process of setting the figures for vaccine coverage for the municipalities. So with that new method, you'll find there's less variability among the municipalities, that they come in line to be much closer to each other than what was shown with our previous figures that we had on our website. And we do have some technical explanation on our website about this, the details about the methods used. The province has made some announcements with regards to additional opportunities for testing related to schools. Certainly, it is our priority and the priority of the province to make our schools as safe as possible and to keep them open. Very important for the well-being of children and their mental health. And in place are many requirements to keep schools safe. But we have noted that there have been outbreaks in primary schools across the province and in Simcoe Muskoka, the populations that cannot yet be immunized. So certainly the screening of children, and for that matter, others who work in the school environment each day before going to school for symptoms and exclusion and referral for testing, is very important to continue using assessment centers for this. But in addition to this, the province now is proceeding with making available highly accurate PCR testing, take-home test arrangement through schools for those who have symptoms or are contacts of cases, in order to facilitate such people being tested. And they are making available rapid antigen testing for health units to call upon to be used to help keep schools open, avoid having to close schools during outbreaks, or to enable them to be opened more rapidly in the case of schools that have had to be closed because of outbreaks. So health units across the province are looking at how best to use these new methods. We continue to have inquiries about schools and outbreaks in schools. And I think, as I've indicated before, it's certainly a priority for us to keep schools both safe and open. And when we do have outbreaks, we do all that we can to limit spread, to contain spread, to identify cases and their contacts, to exclude both from the school environment, and to facilitate testing for those who are contacts of cases or potential cases, all to keep spread from happening further in the school, and to do all that we can to keep schools open. So it is an option for us to close schools if we absolutely must, but we do all that we can to keep them open. And to date, we've managed to keep our schools open, those that have been in outbreak. So we had the following questions from the media, and one of them was, why have there been so many cases reported in Barrie in recent days? Perhaps it's just population math or coincidence, but the city has significantly more active cases than any other municipality. So as I've indicated, that would be a function of two things. One is Barrie's size. Barrie has the largest population of any lower tier or single tier municipality in Simcoe Muskoka. And so for that reason, it will have more cases. And for another, Barrie has been among the municipalities that has had a higher incidence of cases per 100,000 population. And for that reason, Barrie will have a higher number of cases compared with other municipalities. And the numbers of cases that we've seen have been edging up as an incidence, as I'd indicated before, 25 cases per 100,000 population per week for the week of October the 10th, and up to 33 cases per 100,000 population per week for the week of October the 24th. And then I have another question for the media. We received word of an email alerting members of Mapleview Church that quotes a number of Mapleview volunteers and leadership have tested positive for COVID. We are hoping to get some more information if possible, as it appears the affected may have been part of community trunk or treat. My understanding of trunk or treat is that it's an outdoor Halloween trick or treat event that can be conducted by a church or by another organization to be part of the community's trick or treat event. So children would come up and receive candy like they would at a home. So we are aware of a number of cases that have occurred related to this situation. We are seeking follow-up with the leadership of that organization. And from what we hear, the exposures on Halloween being outdoors and limited duration of time would be of a lower risk. But certainly this church has erred on the side of caution of providing some alert to individuals so that they could be aware. And we're happy to take calls from the public to advise with regards to questions people might have about this exposure. So at this point, I'm happy to take questions from the media.
Thank you so much for your update today, Dr. Gardner. As you said, we will now take some questions from the media. As always, we do ask that you kindly limit yourself to one question and one follow-up in consideration of time. Can we start with Erica Engel from Collingwood Today?
Yes, hello. Dr. Gardner, my question is related to the health unit clinics you mentioned for third dose vaccinations. Assuming third dose vaccines will eventually open up to a wider group, could you just, are those going to be like mass immunization clinics again? Are they at the health unit offices? What are those going to look like?
Thank you for the question. And we have been advised that we should be prepared for other segments of the population, maybe the entire population, later into the new year, beyond and into the next year, I guess into the next year. And therefore, we need to look at the capacity to be able to do that. We are developing with municipalities and other stakeholders at least one community immunization clinic for each of the 6 subregions throughout Simcoe, Muskoka. And we do see that they would be larger volume for sure. We're not sure about the details yet about exactly the timing of a rollout like that. I think we need more information from the province. They too are going to need more information from the National Advisory Committee on Immunization about advice for including other populations, other groups. Right now, NACI's recommendations have been on groups that are at higher risk of waning immunity and severe disease outcome, or greater likelihood of transmission to others who are vulnerable or disruption to essential health services. So we are getting ready for others to be included, possibly the entire population, but we do need to get more information. We have to await more information and more guidance from the province.
So the clinics that you mentioned that would be opening as of November 15th, are those in each of the 6 subregions as well?
They are.
And what type
we're essentially thinking, let's start at that point with that approach, be able to manage the volume of individuals who would be eligible to receive for children first and second doses, continue with this as an opportunity for the last mile for those 12 and above that have yet to receive their first and second dose, and to also be able to handle the volume of people receiving third doses.
And what type of locations, like, are you using schools and arenas again?
We're using community municipal venues. Their arenas, like the ice surfaces, are in use, so we don't have those anymore. So there are other municipal venues for the most part. We are going to have at least one school clinic as well, but we're actually going to be better positioned to be able to handle volume in the larger municipal locations. And we will put up on our website before, when booking becomes available, the locations of these sites.
Thank you very much.
You're welcome.
Can we go with Chris Simon from the Barrie Advance? Do you have a question today?
As always, thank you very much. Dr. Gardner, number of numbers have been increasing, the rolling 7-day average, hospitalizations, number of outbreaks. Is there anything in particular that you're looking at right now and maybe seeing a red flag or two?
Well, of course, it catches my attention very much that we're above the provincial rate and that we're edging up while the province is edging down. So that is of concern to me. We're not greatly above the provincial average, but it's a first for us to be above the average. Throughout most of the pandemic, we've been about a half the rate of the province. I don't have a definitive explanation for that. We note that a significant proportion of our cases are children below the age of 12 who cannot be immunized. That's a pattern, though, that's been seen elsewhere in the province, so it's not unique to us. Compared with other parts of the province, we have a younger population, so that could possibly bump up our rate compared with places that have a lower proportion of their population that are children that are in that vulnerable population. And we are seeing a substantial number of school outbreaks, so certainly that is of concern to us. And we are very much focused on schools. We certainly want to protect schools and we want to do all that we can to keep them open. So it's a concern to me that we are having these outbreaks. And it really does speak to just how important immunization is and how important it will be to immunize children once we're given the go-ahead to do so to help address that issue for the remainder of the school year.
Are you worried? I know we talked about pandemic fatigue periodically over the last 19 months, I guess, but are you worried about the fact that maybe people are either becoming skeptical or fatigued with the possibility of several more vaccinations to come when they see rising numbers in a variety of areas?
We have more opportunities for people to mix now. We've got business venues that don't have the capacity limits that they had before. Now, mind you, they are to require proof of immunization, and that I believe is really important and what I hear of data that tracks this provincially effective intervention. We do need really good compliance from our business operators to make that work well. Certainly that's in the interests of themselves to keep their businesses safe, to keep their workplaces safe, to avoid being part of an outbreak. There's the potential with more gatherings for transmission to occur. People do need to continue to be cautious. We do see our breakthrough cases, and we've seen some deaths among breakthrough cases. So I think people need to know that immunization is really important and the single most effective thing they can do, but they need to keep up the other things as well. They need to be cautious about social gatherings, public gatherings, the use of masks and distancing, particularly in indoor public spaces, and caution with their own home gatherings. I think being aware of the vaccination status of people coming over is an important and fair thing for people to know of, given the difference in risk of transmission. People who are more vulnerable, who have underlying medical conditions or older, would need to be all the more cautious. So these things remain to be important. We have seen in other jurisdictions that have had high immunization and let all of that go, a surge in cases. Scandinavia, for example, Denmark has experienced that. And so we know that here in Ontario, we have to keep up some of these measures to avoid having that kind of an outcome. And I think it would be fair to say I can understand people being fatigued by all of this. It's been going on 2 years that we've been dealing with this pandemic, and it's really required stamina of us all to be able to manage it.
Thank you.
Welcome.
Can we go with Craig Momney from CTV Barrie? Do you have a question today?
No, mine was answered. Thank you.
Thanks, Craig. Can we go with Sean Gibson from Barrie Today? Do you have a question?
Yes, thank you. Regarding the Mapleview Community Church situation, I wasn't sure, I didn't catch what you said at the beginning, but we're hearing that there was 3 staff and upwards of 8 cases through volunteers and visitors. Can that be confirmed? Do we know that number, and is it still rising?
I wouldn't be able to give you specifics. I don't actually have that pinned down for one, but for another, we don't. I mean, here we run into, I guess, privacy issues. Normally, there are certain types of venues we give detailed information about cases for outbreaks, and others that we give that information, but we don't give the name of the location. And so normally community churches, agencies like community churches, we don't give both the name and detailed information about the numbers of cases.
And also, too, to follow up, just because we're getting information as this goes, has Mapleview Community Church, and I know you can't give information, but in this case, we think it's kind of important. Have they been following the rules? Have they been ever called upon? Have they ever had the health unit called for infractions or breaking protocol? I know if you go, I know they have video on YouTube. If you go, that there's not all masks in the building, so you can see it. But has the health unit ever been called?
We've never received a complaint about this particular church, or for that matter, any church during the 4th wave.
Thank you.
You're welcome.
Mary Beth Hartle from Muskoka Region, do you have a question today?
I do, thank you. Pardon me. When we spoke a few weeks ago, we were kind of hoping that we'd be hitting that 90% vaccination rate for double dose by a couple of weeks' time. We're at a couple of weeks' time. How confident are you now that we're going to hit that?
It is slow going. It's probably provincially it would be another month before the province gets there, when we've been following the provincial average about 1 percentage point behind them, moving at about the same rate. So in my mind, it would take a couple of months anyway to be able to get to 90% for first dose, and then several weeks thereafter to get to second dose. So I'm very hopeful that we'll get there. We're certainly doing all that we can to get there. And by opening up community immunization clinics with much larger volumes, we have the potential to give those people yet another opportunity to receive immunization going forward. But it's not a certainty that we would get there.
Mm-hmm. And the other thing was, and I'm hoping I got these numbers wrong, did you say 1 out of the 5 had not been vaccinated? and all
Are you
the
talking about, you're talking about the mortality, the 5
Yeah.
cases? It's true that 4 of the 5 had been fully immunized. They were breakthrough cases.
Is that a concern for you?
It is a concern for me. Breakthrough cases in general are, but in particular severe ones, particularly with mortality, is something we need to watch very closely. It does speak to the importance of people continuing with the other control measures, particularly those that have pre-existing medical conditions or those that are older, because vaccination alone is the best protection, but it's not enough. People need to continue with the other protective measures, and when eligible, should seek their booster dose.
Okay. Thank you so much.
You're welcome.
Can we go with Mark Claremont from Muskoka Today? Do you have a question?
Yes, thank you very much there. Doctor, you mentioned that the 35% breakthrough rate, and you anticipate that it may go higher, which sounds to me like could be at some point in the future, half the cases are thereabouts more. Did you know that was going to be the case before this number arose?
I did. It's actually inevitable. As you proceed with immunizing virtually everybody, the only people left to become cases are immunized people. So the number of cases that would occur would be low, but a very high percentage of them, by virtue of that dynamic, will be among those who are immunized. An analogy would be, this has been used before, the use of hockey helmets and the fact that helmets greatly reduce the risk of head injuries. But if everybody on the ice is wearing a helmet, the only head injuries that are left to occur are among those wearing helmets.
Right. So does that speak to the efficacy of the, going forward, what is the efficacy of the booster shots then? I mean, it sounds to me as though, if you're going to be pushing numbers in close to 50%, for example, will this thing ever get over? You know what I mean?
So certainly booster shots have been shown to be effective in greatly increasing immunity for those that are having a waning immunity, particularly those that live in long-term care facilities, older adults, 80 and above. And this is going out beyond 6 months. So they are definitely important for people to follow up with and receive, particularly those who are more vulnerable. As I'd indicated, as we go forward in time, we are going to continue to see breakthrough cases because the vaccines, although highly effective, are not perfect. There is still the potential for some cases to occur. And people need to be aware of that and take their other precautions. So that is not going to change. As I said, that will only go up over time as we succeed in immunizing a greater proportion of the population. What will go down over time is the absolute number of cases that occur. We're seeing that in the province as we improve immunization coverage. The total number of cases are going down, but among them, the proportion that are breakthrough cases goes up as you're left with really only immunized people remaining to become cases, right, as you get closer and closer to 100% coverage. And as for the long-term outcome destiny of COVID-19, I think it's fair to say that we will have that as a pathogen of concern from here on in. And this is something that we're going to have to be managing forevermore. I don't see that this pathogen is going to cease to exist by any means that we have at our disposal. It would be something that we'll have to manage.
Thanks very much, but sorry to hear it. Anyway, thanks.
You're welcome.
Can we go over to the phone line this afternoon? Do we have any questions? Okay. Is there anyone who didn't have the opportunity to ask a question this afternoon? Okay. Thank you so much, everyone. I believe that brings us to the end of our media briefing. Dr. Gardner, thank you so much for your comments today, and thank you to everyone who participated. Our next media briefing will be Wednesday, November 17th. Thank you so much.
Goodbye, everybody.
Recording stopped.
Before the discovery of insulin, diabetes was a death sentence. Banting, Best, Collip, and MacLeod's breakthrough has saved millions of lives. Leonard Thompson's was the first.
Summer days, summer nights, lots of things to do, places to go, and people to see. If you're having a few drinks, be sure to plan ahead and get home safely. We don't want to pick you up. Drinking drivers risk injuries to themselves and others and take chances with their license, their jobs, and their future. Remember what's at stake and choose your ride, whether you're the driver, the passenger, or the party host. Thanks for supporting sober driving. I hope we never meet.
Visit arrivealive.org to find out more.